This is a brief description of intelligent targeting schemes. Now, this is a list of all the available targeting schemes, and as you can see at the top of the list is intelligent targeting scheme, and the lowest is my set point control. And as you can see, that intelligent control is far removed from the standard set point control. What is intelligent targeting? Well, intelligent targeting, the ventilator uses a artificial intelligence program. And it's usually one of 3 programs. However, I'll just be going over one of the programs it uses, and this is a rule-based system. There are 2 modes of mechanical ventilation that you might be aware of that uses intelligent targeting schemes, specifically rule-based expert systems, and one is called SmartCare pressure support, and this is available on Traeger, Avita ventilators, and other ventilators. And the other is Intellivent ASV and the specific Hamilton ventilator, and on their S1 model, which is currently not in the United States. So the example I'm going to be using is the SmartCare pressure support. Before I describe the intelligent targeting scheme in SmartCare pressure support, let's look at the basic mode pressure support. So with pressure support, it is actually classified as pressure control, continuous spontaneous ventilation, and the targeting scheme it uses is a set point, so I'm just going to make a small s here. That's where the operator has to set all control variables. They have to set all the set points. So if anything changes with the patient's breathing pattern, their lung mechanics, the operator is going to have to go and make the changes. Let's look at one example. Many people use pressure support ventilation for a spontaneous breathing trials. And the operator has to set a certain level of pressure support to augment the patient's inspiratory drive. Now let's say the patient's inspiratory demand changes. They're in pain, they spike a fever, or their work of breathing's increased. The operator is going to have to assess the patient, and they're going to have to increase the pressure support to overcome this. Now I'm going to go to the next slide, and this is going to be an example of this. Now here's an example of patient on pressure support, and we can look at the top right hand corner of the screen, and they're on pressure support. And if we look at the lower bottom right hand portion of the screen, my pressure support setting's 5. Now as a practitioner, and if we're evaluating this patient, we can see that the pressure support level of 5 is not adequate for this patient's inspiratory demands. And there's a few things that key us into this. One is we can look at the patient's entitled CO2, and we can see here, okay, we can see the measured value on the screen. In the bottom left-hand portion, that my entitled CO2 is 62. Another thing is that my PEEP level, if you look at my set PEEP first, let's look at my set PEEP at the lower right-hand portion of the screen. My set PEEP is 0, so there's no PEEP at all. However, my measured PEEP value is -12. And I know for sure that the trigger sensitivity is set on a flow trigger. That's why we have this red waveform here. So my trigger is sensitive. It's not like that my trigger sensitivity is set on -12. So this means that my patient is sucking back so much, they have this vigorous inspiratory drive, that there's not enough pressure in the system, and it's actually going to a -12 level. Not only that we see the high CO2, the low inspiratory pressure, we can also look at the waveforms, and one is the flow waveform, and in a pressure mode, my flow should always be decelerating. As you notice, my flow starts out during the first part of the inspiration, however, it starts to decelerate it, where the patient's still sucking back, and it's going up again. So this is termed as camelbacking, to show that there's not enough driving pressure for the patient, so my pressure support's too low. So these are key signs that the pressure support level is not enough for the patient's inspiratory demand. It's insufficient ventilation. And what the operator has to do is they have to increase the pressure support level, or if this patient wasn't being monitored, that they would just wear out. Now let's compare that last scenario with SmartCare pressure support. So SmartCare pressure support, if we would classify the mode, it'd be pressure control, continuous spontaneous ventilation, and the targeting scheme it'd use is intelligent, and that's why I'm making the small I right there. That's supposed to be an I. Now this is a ventilator screenshot of a Vita XL, and it's showing the settings for SmartCare. I have my tab open on the right hand portion of the screen. You can see it's SmartCare, and these are the only settings that the operator set. And this is older software. There's some new revisions with the newer software. However, I do not have screenshots of that. As you notice, the operator sets what their airway is, their medical history, if they want the patient to rest during the night, and the last one is to actually start SmartCare mode to turn it on. As you notice, there's no settings for a pressure support, and there's no settings for how I want the breath to end, or end trigger sensitivity, or rise time, or pressurization rate. So based on expert rules, the machine is going to titrate the pressure support. It's going to evaluate the patient's frequency, their exhale tidal volume, and also additionally the entitled CO2. Now this is an example of SmartCare's rules. These are all the expert-based rules on what it's going to do with pressure support. It's going to classify the breathing pattern, and it's going to make decisions on how to adjust the pressure support. And because you can see there's 8 different decisions or rules, classifications that the ventilator is going to follow to either increase, decrease my pressure support, or do nothing at all. And let's use the last patient as an example on just the regular pressure support. And it's kind of already traced in pencil, but I'm going to kind of highlight it in orange. And here's the example of the last patient I used on the traditional pressure support mode. I'm just going to enlarge this to make it look easier to see, so we can see this classification and what SmartCare would have done. Now this is the classification insufficient ventilation, and as you notice, this is based on a spontaneous frequency of 15 to 36, and we had that in the last patient. So I'm just going to check mark. Entitled CO2, their CO2 is around 62, and it's above 55. And also one more thing, their tidal volume was way less than 300. So what would we do as a practitioner in this situation? Well, we'd increase the pressure support, and that's what the expert-based rule is doing. As you notice, what's going to happen here is that the machine automatically increases the pressure support by 2 to 4 centimeters of water. That was an example or a brief introduction to what an intelligent targeting scheme does.